Hi everyone, it's Linda Esposito from Be Clear with Bronchiectasis. Before we get started talking about sputum samples today, I'm going to ask you to please subscribe to this channel and to please like this video. It really means a lot to me. Okay, let's get going now. Sputum samples. These are sterile cups, and we bring a sputum sample into the lab in a sterile cup. And most of us can get these cups from either the laboratory or perhaps their pulmonologist. So let's just talk about sputum samples and how to get one up. A lot of people produce mucus regularly. I have clients that produce a lot of mucus, like a half a cup a day, and they have no trouble bringing a sputum sample in for analysis. Perhaps they see their sputum is darker, maybe yellow, maybe greenish, maybe it has a little brownish tinge in it, maybe it has a little blood, and they're concerned. They see a change in their sputum and they want to bring it in and have it analyzed. And they have no problem producing a sample, contacting their doctor ahead, making sure the laboratory has the order, and bringing the sample into the laboratory. And often a analysis is three-part. You have your regular respiratory bacteria, such as Pseudomonas, Streptococcus, and Haemophilus, and then you have fungi. And you also have what are called mycobacteria, and that's our MAC that we're always concerned about. And that's the type of infection I in fact, had. And usually you get the results back from the regular respiratory testing, like within the first week or so. Fungi usually takes longer, and mycobacteria can take up to 8 weeks because it's very slow growing. It's not that the lab has lost it, it's just that it takes a long time for them to grow it. So those people who are able to produce a sample, that's how they go about it. But then there are some of us who aren't able to produce a sample very easily. Perhaps they haven't been shown different techniques for clearing their lungs and bringing up a sample. Very few of us have ever met with a respiratory therapist. A lot of the education is actually peer-to-peer. And or they could be what's called a dry bronchiectasis, where they just can't get a sample up. But let's just say that they just haven't learned how to regularly produce a sample. There are some videos here on YouTube that might help you. It's something that I do regularly with my clients. I show them what I do. For a year and a half, I wasn't able to get much of anything up. And then I figured out, how to do it. And it does make a difference, because if you cannot get up a sample, if you can't produce a sample yourself, and let's say you're on medication, you're on antibiotics, you're not feeling well, and the doctor really needs to find out what's going on, then you're going to have a somewhat invasive procedure called a bronchoscopy, where they go in with a scope and they get a sample that way. And so clearly it's not something anyone wants to do, but sometimes needs to do. But wouldn't it be wonderful if you can just, learn how to get a sample out on your own? So hopefully you can meet with a respiratory therapist. Like I said, right now, a lot of the education is peer-to-peer, on different websites, and that's good. And there are YouTube videos. I have YouTube videos. There are other YouTube videos. But ideally, per the bronchiectasis guidelines in other countries, we don't yet have guidelines in the US, that airway clearance should be taught by a respiratory professional. So with all that said, you might want to have some sterile cups handy. Now, I got these from my pulmonologist. Sometimes you pick them up from the lab. But if you're not very productive and sometimes something will come up and it's almost surprising, it's just good when you're doing your airway clearance to have a cup nearby if you know you want to bring a sample in. So it makes sense you bring a sample in if you're not feeling well, but you might also bring a sample in for your doctor's visit. So let's say you go every 6 months, whatever it might be, you might want to bring a sample in. Because it was very surprising where one of my, I brought a sample in just like that when I saw my doctor for my 6-month visit, and Haemophilus grew. And I had no symptoms that I knew of. I was producing sputum, maybe a little bit more than I had months before, and I thought, oh, I'm just doing a better job with my fancy new techniques. But it turned out I did have an infection. So being the type of patient I am, I said to the doctor, okay, because she wanted to put me on antibiotics, a short course. And nothing like the MAC drugs, but a short course. And I said, okay, but let me just submit another culture and another sample, and let's just see if it grows again. And it did. So as far as I knew, I had nothing going on. And here I brought in this sample with a routine visit. And in fact, we were able to get rid of that Haemophilus right away. So get the cups and do your best to learn how to bring up a sputum sample. Let me know if you would like to book a consultation, if you would like to see what I do. Of course, it's never medical advice, it's education for you then to discuss with your medical team. Hope this is helpful. Take care. Bye-bye.